Dr. Francis, I'm calling about patient 427, admitted with acute abdominal pain and fever. Initial tests suggest a possible infection, but the specific etiology remains unclear. We've started broad-spectrum antibiotics as a precautionary measure. However, the patient's blood pressure is fluctuating, and we're monitoring them closely for signs of sepsis. Additionally, there's been a slight decline in renal function, likely due to dehydration and the underlying infection. We've initiated aggressive fluid resuscitation and are closely monitoring their urine output. The patient is also experiencing some respiratory distress, possibly related to the infection or underlying comorbidities. We've increased oxygen supplementation and are considering initiating non-invasive ventilation if their condition deteriorates. We're awaiting the results of blood cultures and urine analysis to guide further treatment.
Understood, Mihira. The fluctuating blood pressure and declining renal function are concerning. Keep a close eye on their hemodynamic parameters and adjust fluid therapy accordingly. Respiratory distress is also a significant concern. Monitor their oxygen saturation levels and be prepared to escalate respiratory support if needed. Once the culture results are available, we can tailor the antibiotic therapy to the specific pathogen. In the meantime, continue with the broad-spectrum antibiotics. Let's discuss again once we have more information. MIHIRA, it is completely natural to feel overwhelmed by the exhaustion and nausea that often define the first trimester, but please know that these symptoms, while difficult, are a sign of the powerful changes occurring within your body. To help you navigate these mornings more comfortably, try to slow down your transition into the day. Keeping a packet of dry crackers or plain toast by your bedside to eat before you even sit up can help settle your stomach by neutralizing gastric acid that builds up overnight. Throughout the day, focus on grazing rather than sitting down for large, heavy meals. Eating small, frequent portions of bland, high-carbohydrate foods like rice or baked potatoes can keep your blood sugar stable without overtaxing your digestion. Many women find great relief in ginger-based products, such as sipping natural ginger ale or steeping fresh ginger tea, as it is a gentle, evidence-based way to calm the digestive tract. Additionally, your sense of smell is likely heightened right now, so it is helpful to stay away from strong cooking odors or spicy aromas that may trigger a wave of nausea. Opting for cold or room temperature foods can minimize these smells. Most importantly, listen to your body's need for rest and stay hydrated with small, frequent sips of water or electrolyte drinks. You are doing a wonderful job caring for yourself during this transformative time.